Hi everyone, this is Dr. Devin Barley with Greenwich Bay Chiropractic, and in this video series we're talking about disc injury, specifically what Greenwich Bay Chiropractic does here to treat discs. And it really starts with the careful consult, the exam, the x-rays, so that we can understand the problem specifically. Discs that affect different levels in the spine, control different things, and we want to make sure that we know exactly what we're working with. There are two kinds of discs typically, acute and chronic. So acute is something that happens suddenly. Yesterday you were picking up a load of laundry and you felt it right away. That's when the disc is acutely, very recently pushing out onto that nerve that exits in the back there, okay? The other is a more chronic disc where over time the disc space in between has started to compress down and we're building up arthritis now in there, and that can cause nerve pinching as well. That's when the spine starts looking like this. You can see how thin the disc is. You can see how mottled the bone is. That's all bone spring that happens in there. And what that does is it closes down further wiggle room for the nerve. So we can do a multitude of things here that treat it very effectively. Number one is chiropractic manipulation. By getting function and motion back into the area, we can help stimulate and unpinch nerves and help pump out swelling and inflammation. We also utilize a tool called decompression therapy, which basically is run by a computer, and what it does is it gives your spine this pull to help open these spaces up to decompress the area and take the pressure off. That is extremely effective for disc cases. And the third, of course, is to work with the muscles, because we know they're probably tight and spasmed up during a case like this because they're overprotecting the area. So we'll come up with a customized therapeutic exercise program for you so that you can do some things at home and give you some agency to be able to work on this at home. And between those three things, disc cases do extremely well, whether it's the neck or the low back. If you have a slipped disc, we absolutely want to see you in the office. Thanks so much for listening. We'll see you on the next video.